Hi, I'm Stacy Zimmerman. I'm one of the occupational medicine residents here at the University of Utah, and I'm presenting my research project along with Eric Wood in collaboration with the staff from the NIOSH Western States Division, including Ryan Hill, Kenneth Scott, Alejandro Ramirez Cardenas, and Caitlin Wingate. The study is titled Working Alone and Remote, Preventing Fatalities from Cardiovascular Events in Oil and Gas Extraction Workers. Oil and gas extraction workers experience unique risks for fatality when performing tank gauging and fluid sampling or transfer activities at well sites. These workers often perform these duties in remote locations without other workers nearby. These factors may increase the risk of fatality, not only due to workplace hazards, but also health-related incidents, including cardiovascular events. Information regarding these workplace fatalities in the oil and gas extraction industry is collected by NIOSH and compiled in the Fatalities in Oil and Gas, or FOG, database. The purpose of the study is to investigate the presence of lone work or an observed cardiovascular event while in a remote oil or gas well site with a delayed response resulting in a fatality from cardiovascular event, with the goal of offering insight into the problem in order to provide recommendations for implementing change to prevent future fatalities. NIOSH FOG database were reviewed between 2014 and 2018. NIOSH collected information about fatal cases from formal investigations by government agencies such as OSHA and the Bureau of Safety and Environmental Enforcement, or informally through media reports and press releases. Other available sources of information included autopsy reports and obituaries. These case files were then reviewed for the presence of lone work, unobserved cardiovascular events, and observed events with a delay in response. The results of the investigation include 49 total case files in the database between 2014 and 2018, a mean age of 51 plus or minus 12 years, with the vast majority being male. 38 out of the 49 case files had enough information to elicit the work status during the cardiovascular event. 19 of these, or 50%, were lone workers. 9 or 24% were unobserved cardiovascular events, and 10 were observed cardiovascular events. Of those 10, 4 or 40% had a delayed response. Recommendations to mitigate the risk of fatality from a cardiovascular event in the oil and gas extraction workers include lone worker programs and policies that formalize communication, staffing guidance, and the role of new technologies, including lone worker systems. Reducing the hazards of remote work by formalizing relationships with local EMS to minimize medical response times and enhancing well site communication capacity, and mitigating the risk of fatal cardiac events with the use of AEDs, providing BLS and CPR training to the workers, and by promoting effective heart disease and stroke prevention services to reduce out-of-pocket costs for patients with high risk. Also, exploring the role of fitness for duty standards and medical guidelines for onshore oil and gas extraction workers working alone or in a remote location is another possibility. Limitations of the study include inconsistent and incomplete information available in workplace fatality case files, especially in 2018, the variability of death investigations, and the subjectivity of variable definitions, including observed events versus unobserved events, workplace cardiovascular events, and medical response times. In conclusion, the FOG database provided by NIOSH provides valuable information to assess the details regarding fatalities from cardiovascular events in oil and gas extraction workers. This investigation offers recommendations to prevent these fatalities in the future. This concludes my presentation. Thank you for listening.